I actually try to think about the things that I've done and I think about my why. And my why is always I want to help people and I want to be able to help people have the access to quality care and have a personal, direct psychiatric care for my patients.
Welcome to the Holistic Counseling Podcast, Priscilla.
Thank you for having me.
Can you share your journey about how you became a practice owner?
Of course. As you know, I'm a physician. I did medical school in Dominican Republic. I did psychiatry residency at the University of Virginia, and I'm also subspecialized in geriatric psychiatry. Even though nowadays my practice focuses more on general adult psychiatry and women's mental health. After training, as you can imagine, I had all sorts of jobs.
Did you take a shift there and who you work with?
Well, I had all sorts of types of patients, but right now I work more with women's mental health and general adult patients. I've done all sorts of things, inpatient work, mostly outpatient the last few years. And like many of us, I've done my community mental health clinic kind of jobs. And what ended up happening is that with all of these jobs, it was very clear to me that if I wanted to do things my way, I was going to have my own private practice. And what that means for a lot of us psychiatrists is that in many practices, they want us to see patients every 15 or 20 minutes, which is not my style. And I figured if I really wanted that, I needed to have my private practice. So my appointments are longer. My follow-up appointments are 30 minutes long.
Wow.
Yeah. I also wanted to make sure that I was accessible to patients. So my schedule is a little bit odd. I do have some hours that are during regular business hours, like 9 to 5, but I have a lot of appointments that are on the weekends or like after 5 p.m. because I want to make sure that there were, other professionals like me could actually have access to see the doctor. So that's how I got started.
That's true, because you think about physicians, that's
Yeah.
probably much more difficult for them to get away for appointments.
Well, I think for many professionals, and even I've had, since I do a lot of women's mental health, I have a lot of moms. So let's say between work and getting home, they're like, I just need just like those 30 minutes for us to talk. And I'm usually able to do that after they're done with work. So it actually works out pretty well. I like it.
That's great. But it sounds like you want to pace yourself too with your appointments, which is amazing because I know a lot of times I have clients that go to psychiatrists and they just feel like, snap your fingers, you're in and out, come on.
Yes, and that is certainly not my style.
Exactly.
I prefer to develop my relationship with patients, and I think that there's so much that is happening in someone's life that 15 minutes of like covering medications and what's happening in your life is not enough.
Ooh, that's tough. Yeah. But you could make more money. I know somebody saying that right now. Right?
Oh, trust me, I've heard it.
Yeah, I'm sure you've heard that. Have you gotten pushback from other physicians in your approach?
I wouldn't say pushback. I would say a lot of them have have expressed to me that, wow, that is actually really cool that you do that, because I think
You're a trailblazer.
A little bit. I'd like to think so. And there are a lot of people that I've met that have left their other jobs and now they are doing private practice, and they tell me, oh my God, I had no idea how burned out I was until I started doing my own thing. Or I had no idea how much I love medicine because now I have a renewed sense of purpose and I'm enjoying my patients more because now I don't feel so pressed for time, or I don't feel like somebody's breathing down my neck with like productivity and all sorts of things.
And numbers and
Exactly.
all that.
Yeah.
Ooh, that was rough in community mental health, man. I remember the owner would be like, here's your numbers. Your numbers are down. I'm like, because they all cancel. It's not my fault.
Well, yeah, there's so many nuances when it comes to having a practice. And I actually was talking today with a friend of mine who he's a psychiatrist, but he also did an MBA. And he's actually working more from the administrative side of the practice that he works at. And I was telling him that it's so great to have someone that actually has been in the trenches and actually knows what it's like to see patients and what we need to do, and help that inform his decisions as an administrative person. Because a lot of times you have all these people that have really no experience in mental health, and they don't really understand what happens in a session and after a session and in between, essentially.
True. Yeah, no, that I think that's great for that empathy piece, so understanding that where you're coming from. So tell me about your personal experience with fear of failure. So
Ah,
has that come up for you to break away from community mental health and the other places you've worked?
well, I would say it's a work in progress at least once a
Or
day.
still there? Get a little panic going on?
Certainly, certainly. I think the fear of failure has always been there, and I think it has to do with how many times I think it kind of helps us be better. It helps us say, okay, I don't feel like I have enough knowledge, so I'm going to study more. So, and all those things are the nice things about it, let's say. But the fear of failure is a real thing, especially when you're opening your private practice. And honestly, I really thought that it was just going to be like that initial part of opening my practice, but it has been throughout. And I think it has to do with kind of comparing ourselves and also constantly thinking about, well, what if this doesn't work out? What if I fail at this? Does that mean that I'm not good enough? And all the thoughts and emotions that we have behind that. For me, it shows up not a whole lot in the ways of like, I don't have enough knowledge because I think I am qualified. But that also has been a work in progress because
True.
yeah, that developing that confidence in how good of a psychiatrist I am has taken some time. But I think it has to do when we start seeing like other people's practices. And I'll give you an example. I was looking for an office space, and a friend of mine had just opened her space. She's not even a psychiatrist, and she was showing on social media her new office space. And my first thought was, oh my gosh, this is so cool for her because I know how hard she worked on that. But then the second thought was, see, she has an office space and I don't. Like, how am I ever going to grow a practice? I don't know anything about business and so on. And it had to be, and this is something I still practice every day, which is like taking a moment and try to reframe the way that I think about what are perceived failures. And I put that in quotes because it's not
You said
really
perceived
exactly
failure.
what is perceived failure, because it's not a failure just because she's opening her practice, has an office space, not a failure on my part. Eventually I find an office, and I have an office where I see patients. So you know what I mean? So I think it has to do with sometimes how we compare ourselves and also what we think of the expectation should be. And that's why I say perceived, because it's not necessarily true.
Yeah. Yeah, for sure. And I know a lot of listeners are mental health clinicians who are either starting or have started that. And it can be a rocky road. Now for me, what's happened is it was a slow progress for me to build my caseload. And I did not write on Facebook like some people, oh, after 3 months, I'm full. And not permanently full. No. So there's the ebbs and flows. So I think the fear of failures come up sometimes too. Like, oh my God, like I'm really light on cases this week that
Oh yeah.
I'm like, ooh, what do
Yeah.
I need to do? What am I doing wrong? Does that happen to you at all?
Yes, and I would even take it a step further, not even when we're talking about like, not having enough patience and all that stuff, but also the business side of it. Because I don't know about you, but like I didn't receive business classes when I went to medical school or residency. So there has to be, a moment, and I would imagine everybody goes through this where you're like, oh my gosh, I have no idea what I'm doing when it comes to business. And then you have to start learning more and more about it. And then you start thinking about, wait, do I have enough money for this? Does this mean that I can afford buying this thing that would be helpful for my practice? Do I even need it? Am I going to have enough patience to be able to actually make my payroll? So, I mean, there's so many things that we don't really, that we don't think about a whole lot when we are in training. And then after training, when we open our private practice, then all these things kind of start flooding in that, it's part of owning a business. And I think also us mental health practitioners have also been trained to sort of not be very comfortable with talking to patients about payment. And I remember I had a professor in residency who said, you have to be comfortable talking about money with patients. And I had a conversation with her. I was like, but I don't know, like, I just want to help. Like, it feels
Yeah, for listeners, she just made a face.
oh my god! The thought. I'm remembering where I was in my office in residency when I
Yes.
had that conversation because it was so uncomfortable. And then she said the most amazing thing. She's like, you actually owe it to your patients to to do that, because if you want to help people, your office has to be open. And for that, you need to be able to make money.
I
If
love
you,
that.
yeah. And it's like, if you want to do pro bono work, or you want to have a sliding scale or something, if you want to do that, your business also has to make money in order to be able to do that. So in a way, you have to be comfortable with doing these things, so that way your business can thrive and you can do the other things that you want to do.
That's a good theme for people to remember for
Yeah.
sure. That we have to do this. But I think, isn't it too, that listeners also have to work through their own money issues?
Exactly. Exactly. There is the fear that, okay, I'm not going to have enough. What if, or like, for instance, when the normal, and I think you probably have experienced this, where there are times of the year that you're getting patients all the time and then it gets really slow. And what are some of the first things that we think about? Oh my gosh, I'm not going to have enough patients. I'm going to have to close down. This is, I mean, and then we start catastrophizing
Like, how
everything.
much do I need to pay my bills this month?
Exactly. And then we start thinking, none of this stuff is actually going to work out. And it has to do, I agree with you with the way that we think about money, also like our own limiting beliefs when it comes to money, but also, our understanding of the business and kind of how it works out. And I mean, this is a whole conversation when it comes to like, how do you plan for slower months and all those things. But I think it's very hard to go through all these different stages in your business in just 1 year, or even, a few months, and then not think about, am I really doing the right thing? This is just not going to work out. Yeah. And then eventually I'm going to fail.
There's that thought, right?
Yeah.
Yeah, no, I hear you. And there's still things that I'm still learning. And I opened my private practice with an office space in 2015, but I just got a letter from the state taxes in North Carolina. I was like panicked about something that I got, and I just sent it to my accountant. So it's like there's still stuff that you're still learning. And I think just giving yourself grace, giving that card of grace to
Yes.
say, hey, it's okay. Let's find out the information. Let's be
Yes.
rational about this. Let's figure out what we need to do. And
Certainly. And I don't know about you, but do you like doing like the business side of things,
no,
like the bookkeeping, the accounting? Because exactly, to me, that is the most boring thing. And I procrastinate on that. I mean, not as much as I used to, but like before I was like, yeah, sure, I'll do it next week. I'll do it next week. And then eventually anxiety thrives in avoidance. So by the time I got to it, then I'm all anxious about, okay, like, do I have enough money to do this? Is there anything else I need to do differently? And I mean, it's a very complex issue. And also, if you really think about it, the way that we think about failure, I think is at the root of everything. We think of failure as something actually bad. And I would say my hardest work has been on reframing the way that I think about failure. I try not to think about failure, but rather think about it as feedback. That, I try something, I experiment with something. If it works out, great. If it doesn't work out, then I can learn from it. But that is not to say that that doesn't come with thoughts and feelings behind
it
it.
is true. It does
Yeah,
take some intentionality and work through and
yeah.
reframing, because it's easy to get overwhelm yourself with that, but to take it personally, because sometimes we might start something and it's not working, but it may not just be personal. It may be
Oh,
so
yeah,
many factors going on. Like, let's say you started something new and the pandemic hit. Well, guess what? Then you have a whole other factor. So I think just keeping an
exactly.
open mind to that too.
Exactly. Like when I opened my private practice, I opened it as a telemedicine practice, even before the pandemic, because I wanted to make sure it was accessible to people. And the year that I actually wanted to get an office space, that I actually needed to start looking for an office space, then the pandemic happened. So then now I'm like, okay, nothing has really changed, but then marketing has to change now because we're in the middle of a pandemic. So things are completely different, and we have to take on all these different things. And oh my gosh, there's so many things I've done that haven't really worked out. And it always comes with the thought and, this is not good. I'm never going to make it. I'm going to fail. The sadness, the frustration, the anger, the feeling lost. But then once I'm done with that part of the grief, then I'm able to kind of see things for the bigger picture. And then I'm able to get back on the horse, as they say.
Yeah, yeah. So as long as you could pick yourself back up too. So, well, how do we stay in that mindset, that more resilient mindset? What do we do?
I don't think you can easily stay there.
Why
I think,
not?
well, once I figure that out, I'll let
Let
you
me know.
know. I mean, the reason why I say that I don't think we can actually stay that way is because the business can be fluid, and you have to
That makes
change.
sense.
You have to change so many times the way that you do things and the way that you think about things, that I actually think is an advantage to be flexible and not only think about one way. One of the things that has helped me, like I said, is trying to reframe the way that I think about failure, and also recalling my past successes. So if I feel kind of a little bit kind of wobbly, and I'm like, this is really not going to work out or something, then I actually try to think about the things that I've done, and I think about my why. And my why is always, I want to help people, and I want to be able to help people have the access to quality care and have a personal direct psychiatric care for my patients. And once I go back to that, then I feel, okay, this is good, because I'm accomplishing that, and I have accomplished that many patients. So I'm like, okay, this is good. And thinking about that, and also pairing that with being able to gather my tribe, which is composed of like my family, my friends, my colleagues, people that remind me that, hey, this is good. You cannot compare yourself to this person because X, Y, and Z, and kind of gives you that reality check. Let me give you an example. One of the things that I want to do in my private practice that I want to expand is as a speaker. Several months ago, I was invited to speak on a podcast about anxiety. I literally got the text, I chuckled, and I showed it to my husband. I was like, this is a joke, right? Like, I don't know anything about it. And he's like, what do you mean you don't know anything about anxiety? This is your bread and butter. Like, this is what you do every single day. You've been trained, like you've been in training over half of your life with this. And I remember thinking, I was like, you know what? It's absolutely right. And then he said something very interesting. It's like, there are people with less qualification than you are actually providing advice online.
Yes.
So keep that in mind. I was like,
Kudos to him, man.
so
That was
yeah,
a good pep talk.
yeah, that was very helpful. And as a result of it, then I have to remind myself, okay, so I know these things. That doesn't mean that I don't prepare. It doesn't mean that I don't keep on reading and I stay up to date with stuff, but I am much more confident since then. I've been a guest at multiple podcasts and social lives and all that. And still I get scared. Still
Me
the thought goes
too.
through my mind that this is not going to work out. It's going to
I
be a
do
big
my deep
flop.
breathing
Yeah,
before.
and then I just go through it, and then I usually just afterwards, then I try to think about, okay, how did it go? And that's what I mean. Like, I think being able to recognize or acknowledge your thoughts and emotions, and not really judge, if, let's say, you get a positive or negative feedback, but rather just take it as feedback. I think what really helps in the success of a private practice. I don't think that, you think about, oh, I just want to avoid failure. One, is not realistic because it's part of life. But then also two, it's just not really failure. I think not trying would be failure. That that
That's
that would
true.
that would be, I
Yeah.
would be more concerned with not trying.
Yeah, my husband says when I recently had a contractor I hired that was a therapist that quit on me,
Oh.
unexpectedly on Friday, so, yeah, I was cursing up a storm. But, my husband's like he's all calm, "What is the lesson there?" He's like my little Buddha.
And you're
But
like,
it's
no.
true, isn't it? What is the lesson, right? Whenever something doesn't go well.
Well, yeah, and I think it's easy to think about that once you're like calm, cool, and
Calmer.
collected. I think in the moment,
In the
it's
moment, it
just
may not be, but
it's just not possible. And I think that, like what you were saying earlier, it is really important, like allowing yourself grace to go through the moment, experience the emotion because you're a human, and experience the emotion, go through it, and then go back and review the
exactly.
situation.
And
But
reflect, right? What do I
exactly,
want and where am I going now? And how can I reroute just like our GPS?
exactly, and just
Recalculate.
recalibrate. Exactly.
Because
See,
we
great
got to do
minds
that a
think alike.
lot in business, don't we?
True.
Because some things we try are just not going to work, period.
And also, what works for one practice doesn't really work for another. Like I said, in physicians, I am part of a lot of different Facebook groups, and like what you were saying earlier, somebody was saying, "Oh, I got 200 patients signed up and whatever," and I was like, "Okay, that's great, but ouch,"
Like a punch to the gut. No.
Yeah. But then that's a different kind of specialty and that's a different kind of practice than what I have.
True.
You know
Yeah.
what I mean? Like my patients are people that want to work, are people that are busy, that are stressed, and I want to provide that kind of care for them. And my practice is not for everyone. There are people that perhaps they don't want to work with someone that sees them, for longer periods of time. That they actually want to be seen 10 minutes. Not my style because I don't think in 10 minutes I get to know you. So it really depends on what the practice what the focus of the practice is. And like I said, I'm really interested in physician wellness, in women's mental health, and particularly with women, we're many times in impossible situations. So that is not something that you can do in 15 minutes. And that's I don't want to be in a place where I am forced to see patients so quickly because
That's true.
I will not get to do the care that I want.
Yeah, and it's finding, I think, like you said, the right clients for you and your practice. Because once I'm with my ideal clients, I mean, we're grooving, we're moving along, and things are going great, and I see the progress they make. But if I'm with someone that's just not working, and I just take any client that comes my way, it's not helpful for either of us.
Exactly. And that, like, for instance, like I have patients that I give hugs, which is something that I was trained that you never do. But there's a human in me that actually says, well, what this person actually needs right now is a hug. And
Right.
if appropriate, of course, I'll give you a hug. So, I talk a lot. Sometimes I curse, I always apologize if I do, but I sometimes it does slip. And that is something that
But
my
you're
patients
human. Yeah.
exactly, that I'm human, and I want my patients to be able to see me as a human, and also be able to see, hey, it's not like we're not disconnected. It's not, you're not distant from me. And that is not every patient is appropriate for my practice. Like I said, there are patients that also, that they might say, well, you know what, it's too complicated, or I need more intensive services. Then that's the other thing. Like my practice would not be for someone like that, but I will certainly help them get connected with someone because I want to make
Right.
sure that they get the
Mhm.
care that they need, even if it is without
Exactly.
me.
Yeah, for sure. I always say that too as part of my practice. If I can't help you, I'll help you find someone who can. And I think that's
Exactly.
just showing good care for people in our community.
True. And I work also very closely with the therapist that I share patients with. So, that is another thing that there are I had one patient once said, oh, I don't want you talking to my therapist for my primary care. And I'm like, well, then it doesn't work out because I actually need to work with these people. Like the therapist sees them more frequently than I do, and I need to be able to coordinate care with everyone. So that would not be an ideal patient. Um,
Yeah,
but I am very grateful that the patients that I have and the patients that continue to seek out my services are people that are in the same wavelength as I am. They want to develop a relationship. They don't want something that is like very cut and dry, so they want to work on their mental health issues, but they want to do that with compassionate care and not just like hey, here's a prescription, good luck to you.
exactly. Well, what would you say to therapists who want to maybe expand outside of just therapy? Like you said, doing speaking things or maybe doing workshops, but they've never done that before and there's a lot of fear there. What would you say to them?
Well, I would say think about the things that you want to do, and the things that you enjoy doing. If you are someone that enjoys talking and you like educating people, then maybe speaking is for you. If you want to be able to educate people, but let's say you don't want to speak in front of a big group, maybe creating videos or doing workshops could be your thing. I know that sometimes people do affiliate programs
Yes.
where, that they get extra income that way, but I would say it really depends on what speaks to you. I am much more introverted and I have social anxiety. I hate public speaking. I don't like big networking events. That being said, if I don't do any of those things, then I'm not able to get what I want. Like I am
Sure.
very passionate about educating people and mental health issues, particularly women and perinatal psychiatry and all that. In order for me to be able to do that, I have to get over my fear that it's going to go bad. So
It's true.
so that I have to kind of jump on it, if you will, like the big networking events. ones that I absolutely dislike, I have met the most amazing people there that are still in my life.
You
So
never know who you're going to meet.
exactly. You never know. So even if you're afraid, even if you're not sure, just try to get your feet wet. Something, whatever it is, try it out, see how it goes, and then just take that feedback and figure out if that is the way you wanna do things. Like I know that whatever I do, I don't ever want to give up my clinical work. And I know that I will never do an MBA. I know that I will never do like business stuff because I just don't like it. But I am definitely passionate about educating, doing the speaking on these topics and my clinical care. So I'm definitely working on those primarily. But yeah, but I would say just kind of think about what you want to do, be kind to yourself, and separate yourself from the business. If something
Yeah.
happens in the business and is not going well, is the business is not a reflection of you as a person. But yeah, but I would say whatever it is that you want to do, we also need to practice kind of having that little bit of separation. So that way it doesn't feel like, okay, this is just a direct reflection of me, whatever endeavor.
Yeah, true. I think it does take some bravery too to put yourself out there. But what I did too is also talk to people in the field who have been successful with whatever I
Hmm.
want to do, like podcasting. I jumped into that. But I was like, if we back up the truck, I took a lot of courses. I talked to a lot of podcasts. I did my
Agreed.
research. So it's finding people too to set
Mhm.
yourself up for the most success
And
too.
and I think that's where the community comes in. The
Yeah.
things
Yeah.
that have helped me in my career have not only been, like I said, like my family, my friends, and colleagues have been like podcasts like yours. Like I was on you the other day. I really enjoy the podcast because I feel like I learn a lot.
Oh,
And
thanks for listening.
and there are so many things I've done, like business courses, all those different things that that perhaps take extra time, but it is also an investment. So you also have to think about it that way, that if I really want to thrive in my business, then I really need to do things a little bit differently. And that may mean connecting with mentors, connecting with other people, asking how other people are doing things, and kind of pick and choose what would work for you. Because like I was saying, what would work for one practice may not work for another one. Having a medical practice is completely different than having a therapist practice. That being said, I listen to a lot of podcasts that have to do with therapy, private practice, because I have found those to be very helpful. And I also do my medical practice podcast. And so, I mean, as long as we have the thirst to learn, and that we're ready to take chances, take risks, and just take the feedback, process the emotions and the thoughts, we should be gold.
Yeah, totally. And I think one thing I recommend too is getting coaches. I've hired coaches
Yeah,
before too, because guess what? There's people who have walked that walk and been very successful. So sometimes we need a little bit of an extra help in that. Just don't be afraid to do
mhm.
that. That is money investing in yourself too.
Agreed. Agreed.
Yeah, and delegating. I will say that too. So I have a virtual assistant who is amazing. I have an editor for my podcast, and I have a social media person, and it is the most wonderful money spent ever.
I agree. I agree. There are so many things that I think that not only about the time that it takes you to do all these different things, but also the mental bandwidth. Like once your mental effort goes into something, you may not have enough energy to do something else. And I'm not just talking about private practice stuff. It's just like even being present with your family. If
Yeah,
you're so
exactly.
tired, mentally and physically tired from wanting to do it all by yourself, you're just not going to be there. You're also not going to be there for your patients. So again, you owe it to your patients to take care of yourself and delegating
Yes.
and being okay. So that way you can provide the care that you want.
So what kind of self-care do you like to do to help yourself to stay more grounded?
Well, I always meditate. I don't do long meditations, 30 seconds to 60 seconds, and I visualize my day actually.
Oh,
Yeah, I find it very helpful. And the way that I visualize it is like if everything that I wanted went the way that I wanted. Not only that puts me in a really good mood, but it kind of helps me get centered.
I like
Um,
that.
Thank you. I also journal my thoughts, and I have different notebooks. I have like notebook for like business ideas. I have a notebook of just like whatever comes to mind. And then I have another notebook where I just write down like my thoughts and my emotions, kind of what is happening in the moment. Another thing that has been helpful is that, like what you were saying earlier, like asking for help, I always touch base with my people and I'm like, hey, I'm kind of feeling stuck with this, or I am not sure that this is kind of working out, or I'm just like really tired. Like, as entrepreneur, burnout is a real thing too. I mean, there are times that I'm like, I just really don't want to think about any of this stuff. And it just doesn't, and that's when I kind of get this sense, okay, I need time away from this and I need to rest. And then once I'm able to recalibrate, the other thing I do is that I plan ahead and then I start making my goals and figuring out, okay, what is it that I need to accomplish this goal? And when am I going to do it? Like the SMART goals, you probably read that somewhere. But yeah, it's all about calibrating and kind of what would work for you.
Yeah, and I think that it's something that you do have to make as an intention every day and don't wait for
Right.
vacations or holidays. It is something that's
Certainly.
gotta be done all the time.
Oh yeah, even if it is like if I'm actually feeling, there are two things that I've trained myself to do is that if I'm feeling really overwhelmed by something or like the day, that is actually when I pause and I meditate for 30 seconds because I feel that that helps me
That's
again.
so doable too. I've never heard someone say 30 seconds to a minute,
Because
I
all I
think
need to
that's
do is,
amazing. Mm.
yeah, all I need to do is to breathe,
Yeah.
really, and just kind of tell myself, you know what, you're going to be fine. You're doing the best that you can right now.
Well, it sounds
And
like some self-talk in there too.
oh yeah, of course. And I because that also helps me prioritize things. Because I also think that when we feel so overwhelmed, we think that everything is important. And
That's
I
true.
think that that makes it hard for us to then make decisions. What is it that needs to be done first? But then once I calm my mind, then I'm like, okay, the first thing that really needs to happen is this, then this. So I think of it more as a grounding technique. The other thing is that if that doesn't seem to be working as well, then I try to distract myself by watching something stupid on YouTube that makes me laugh.
Me too.
Uh, and that's it.
Well, funny
I mean,
cats.
exactly, exactly. Like sometimes I watch, like, have you seen those little dogs that are like really fluffy and they kind of trip everywhere?
No, I wanna see that
Oh
now.
my gosh, I'm gonna send you the link. So
Yes.
they're sort of like huskies, but they're like really tiny and really fluffy.
Put it in the show notes.
Yeah. And they seem to trip everywhere.
Oh my
And I
god, I
find
love
it
funny
so,
animals. There's something
yeah, I
about
find
it.
it so funny. And again, it's
Yes, I
nothing
hear
like
you.
really sophisticated or anything like that, but it does give me that little bit of a break. Now, if I am feeling like I am not competent as a psychiatrist in the moment, one, I remember that feelings are not necessarily facts, so that helps too. And then I actually read an article or something where I feel I learned something. And if I learn something, I'm like, okay, this is good. I learned, this is good. I feel better.
Okay, yeah,
Yeah.
that's really helpful advice too, but I think what you just said too is like, "I got this," right? That
Yeah,
I can do this. That the way that we encourage our clients, we gotta encourage ourselves because 'cause we're all gonna have those low moments,
of
and of
course.
course, getting your own therapy too, I think is so important, especially if you're starting something new.
Oh yeah, and not only even if you're starting private practice, is that the kind of work that we do with patients, a lot of times brings stuff up for us, and I think having a therapist, I think that should be as important as you having like your primary care, as important as having your meal. That should be part of your self care toolkit, if you will.
Absolutely. So is there any takeaway that you could share today for people who might just be starting on their holistic journey?
Yeah, reframe the way that you think about failure. Failure is not really failure, is just feedback. And try to acknowledge the thoughts, the emotions that come when things don't really work out your way. And then think about how can you take a lesson from what happened, what worked, what didn't. For that matter, look for, let's say, something in social media, you got comments and stuff. Even if it is positive or negative, just kind of watch how you feel and what you think about it. And regardless of what it is, just think about it as feedback. Don't judge yourself for it, but rather just reframe that you think about the whole word
Good
failure.
mantra. In
Yeah,
yoga, we say mantra. Yes.
mantra. I like it. Yeah. Yeah, exactly. Create your own mantra around the reframing of the word failure.
So what's the best way for listeners to find more about you?
Well, they can go to my website is www.luxpsychiatry.com. In there, they have my email. There's a phone number. If patients want to work with me, they just have to click on new patient. The system walks them through the whole thing. They'll have access to my calendar. But I'd be interested in learning more about what other people are doing. So if they want to send me a message with what has helped them, I would be very grateful because I also want to
Yeah.
learn what other people are doing.
Yeah, and we'll have that in the show notes for listeners. But I want to thank you, Priscilla, for coming on the Holistic Counseling Podcast today.
Thank you for having me. This was fun.
This was fun, definitely. And that brings us to the end of another episode. Be sure to tune in next week for another episode on Wednesday. And listeners, I want to thank you today for your continued support. Are you someone who's getting a private practice started? I know starting a private practice is hard. I've been there. My colleague and former coach Joe Sanek can help. So he's offering an affordable course to help you learn everything you need to know about effectively marketing your private practice, including types of marketing, how to optimize your website, paid advertising, and how to create quarterly marketing plan. All this for $97. Go to hcpodcast.org/market your practice. That's hcpodcast.org/market your practice. And once again, this is Chris McDonald sending each one of you much light and love. Till next time, take care. Thanks for listening. The information in this podcast is for general educational purposes only, and it is given with the understanding that neither the host, the publisher, or the guests are giving legal, financial, counseling, or any other kind of professional advice. If you need a professional, please find the right one for you. The Holistic Counseling Podcast is proudly part of the PsychCraft Network.